Coronavirus. Here is the outline for this video. Introduction, Morphology, Pathogenesis and Pathophysiology. Clinical findings, laboratory diagnosis, epidemiology, treatment, prevention and control. Introduction. Coronaviruses are large enveloped RNA viruses. Coronaviruses were so named for the crown-like appearance of their virions on electron microscopy. Human coronaviruses cause common colds, which may cause lower respiratory tract infections, and have been implicated in gastroenteritis in infants. Severe acute respiratory syndrome (SARS)-associated coronavirus (SARS-CoV) is a described coronavirus. Morphology. These are enveloped viruses measuring 80 to 160 nanometers in size on electron microscopy. The glycoproteins appear as club-shaped projections 20 nanometers long and 5 to 11 nanometers wide on surface of the envelope. The genome, in association with N protein, forms a helical nucleocapsid. The virus contains the glycoproteins E1 and E2 and a core nucleoprotein N. Some strains also contain a glycoprotein E3, which is a hemagglutinin neuraminidase. E1 glycoprotein is a transmembrane matrix protein. E2 glycoprotein mediates viral attachment and membrane fusion. The glycoproteins appear as club-shaped projections on surface of the envelope. Pathogenesis and pathophysiology. The coronaviruses are confined strictly to the mucosal cells of the respiratory tract. These viruses typically cause infections in the upper respiratory tract, because the optimal temperature for replication of viruses is 37 to 38 degrees Celsius. The envelope contains a E2 viral attachment protein, B E1 matrix protein, and C N1 nucleocapsid protein. SARS-CoV causes infection in the respiratory tract by binding to angiotensin-converting enzyme 2 receptors on the surface of respiratory epithelium. Early phase of the infection produces RNA polymerase E. Late phase produces structural and nonstructural proteins from a negative sense RNA template. This causes alteration in fluid balance and leads to development of edema in alveolar space. Diffuse edema resulting in hypoxia is characteristic of pneumonia caused by SARS-CoV. Clinical findings. 1. Common cold. This causes more commonly upper respiratory tract, and less commonly, lower respiratory tract illnesses in humans. Common cold caused by coronaviruses has an incubation period of 3 days. The condition is characterized by rhinorrhea, sore throat, and low-grade fever. The condition typically lasts for several days. 2. Gastroenteritis. The coronaviruses have also been reported to cause gastroenteritis in children and adults. The symptoms are mild, and the condition is self-limiting. 3. SARS. SARS is associated with the onset of flu-like syndrome, which may progress to pneumonia, respiratory failure, and in some cases death. The incubation period varies from 2 to 7 days, although it may be as long as 2 weeks. Stages of the disease. The first stage of the disease is characterized by fever 30 degrees Celsius, fatigue, chills, malaise, anorexia, and myalgia. The second stage represents the lower respiratory tract illness that begins 3 or more days after incubation. Hypoxia, cough, dyspnea, and breathing difficulties are common findings. Cough typically tends to be dry and non-productive and may range from mild to severe. Fever is typically higher than 30 degrees Celsius. Laboratory diagnosis. 1. Antigen and nucleic acid detection. Coronavirus antigens in cells in respiratory secretions may be detected using the ELISA test detected by examination of stool samples by electron microscopy. Polymerase chain reaction (PCR) assays are useful to detect. It can be detected between 4 and 8 days of infection. 2. Isolation. SARS-CoV can be isolated in viral cultures. Isolation of virus is attempted only in Class III laboratories. 3. Serology. ELISA, indirect immunofluorescent antibody assays, and hemagglutination tests may be used. It is possible using a passive hemagglutination test in which red cells coated with coronavirus antigen are agglutinated by antibody-containing SARA. Videos explaining ELISA, PCR, agglutination tests among others, would be out soon on this channel, so you can subscribe and get the update as soon as I drop them. Epidemiology. 1. Geographical distribution. The SARS outbreak in 2002–2003 predominantly affected mainland China, Hong Kong, Singapore, Taiwan, and Canada. Today it has moved from endemic to pandemic, with a total of 3,267,184 cases and 229,971 deaths documented on 2 May 2020. 2. Reservoir, source, and transmission of infection. Primarily transmitted by close person-to-person contact. The infection would possibly have been acquired by inhalation of infectious droplets during the act of coughing or sneezing, from a SARS patient. Treatment. No specific antiviral treatment is available against SARS, however, some government authorities have allowed the use of remdesivir, an antiviral drug, as an experimental drug, and some agencies are currently working hard to produce vaccines for this deadly virus. Prevention and control. Airport screening for potentially sick and/or febrile passengers is being carried out by using body heat scanners. Individuals with a skin temperature of 37.5 degrees Celsius or greater glows bright red on the scanner. Isolation of patient and strict barrier nursing is crucial to prevent transmission. Quarantine of those who had been exposed, and travel restrictions, as well as the use of gloves, gowns, goggles, and respirators by health care workers are all preventive measures.